Welcome to the Specimen Not Found podcast. This podcast explores the life and careers of clinical laboratory professionals and discusses issues that can help inform other members of the healthcare team and the public about what makes clinical laboratory science such a critical profession within healthcare. We are your hosts, Dana Bostic,
Trudy Jones,
and Letycia Nunez-Argote. We are faculty members with the Clinical Laboratory Sciences Department at the University of Kansas Medical Center. To kick off this first session, we want to ask, have you or someone you know ever had blood sample taken for analysis?
Ooh, I have a story.
Yes, tell us your story.
So, this very weekend, I was working in the microbiology lab, and we actually got a phone call from the heme department who said, we think we have a malaria patient here. So, they brought us over the slides, and we confirmed, looking at the red blood cells, that there were the little ringed parasites inside this blood cells. So we called the attending resident, who was surprised and told us, well, that doesn't really fit. So we were talking to him and brought up the medical record, and there it was, travel to Africa with cyclical fever. So just that right there, we were able to probably save that patient a couple days in the hospital or possibly even save their life.
Well, that's a really incredible story, Drew.
Well, thank you.
And how about you, Dana? Do you have any really interesting stories?
Oh, well, actually, I have one more so from a personal experience. I think it's really interesting how we can take what we do as a living and apply that to our own personal lives. So my mom was hospitalized a few years ago, and at that time, she had a really low hemoglobin count, and the doctor basically assessed that she would need future blood transfusions. And so the order was put in for 2 units of cross-matched blood, or compatible blood, and I inquired, of course, my clinical lab scientist side, I asked the nurse if this blood was going to be irradiated. Mm-hmm. And the nurse asked me what that was exactly, and I'm like, well, it's an additional step that you have to take with blood products if a patient has immunosuppression or certain forms of cancer, leukemias, what have you. And my mom had recovered previously from childhood leukemia. And so I was wondering if that order was in her chart. And, of course, it was not there. Mm-hmm. And I was like, well, you need to add that to the chart. And if you want me to explain this to the physician based on her medical history, I have no problem doing so. And I was like, can you find out from the blood bank if they have an irradiator on site? Because if they don't have it on site, then they need to go ahead and order it from the Red Cross as soon as possible so it can get here in enough time for when my mom will need it. And so I just thought that was a perfect example of how what we do professionally can also impact our families or even our friends, especially in the course of their healthcare treatment.
So as you can now see, like, the laboratory is a very important part of healthcare, and while we don't always get the praise we might deserve, we play a big role in the overall scheme. It's estimated that the clinical lab leverages between 60 and 70% of all critical decisions, and this includes admissions, discharge, and even drug therapies. So what is the clinical laboratory science, or CLS? You'll hear us call it that constantly. What CLS is it's a career where specialty trained individuals who are typically employed at hospital laboratories work as healthcare detectives. What we do is we recover critical information from your blood, your urine, your serum, even your poop. And we can find data from these specimens and use it to analyze it and give the healthcare team information about your individual prognoses. This data can directly lead to improvements in treatment and diagnoses. Different areas of the lab do different testing on different parts, and these specialty areas include chemistry, hematology, transfusion services, or blood bank, which is Dana's specialty.
Oh, yeah.
Clinical immunology, which is Letty's specialty.
Yep, that's right.
Clinical microbiology, which is by far the best, and my specialty, and the emergent field of molecular diagnostics. So now that we've gone through some of the areas, what are some of the professional opportunities in the field of clinical laboratory science?
Well, let me tell you about these professional opportunities. The molecular laboratory science profession has more than one career track based on the level of education. According to the American Society for Clinical Laboratory Sciences, ASCLS, medical laboratory technicians, or MLTs, which are individuals who have an associate's degree, are people who can be competent in the collection, processing, and analysis of biological specimens, the performance of lab procedures, and the maintenance of instruments, as well as relating lab findings to common diseases. Whereas medical laboratory scientists, or MLSs, are individuals with a bachelor degree. They have a little bit of more of extensive theoretical knowledge base, and they not only perform tests in the laboratory, but also do more sophisticated analyses. They evaluate and interpret the results, integrate the data, they do problem solving, consulting, and then conduct research and develop new test methods. Both of these professions are eligible for certification under the American Society for Clinical Pathology, ASCP, in order to become credentialed professionals. And finally, Doctors of Clinical Laboratory Science, or DCLS, which is an emerging advanced practice degree, are laboratory professionals who work directly with the clinicians and patients to improve diagnosis, treatment, and disease prevention as consultants, researchers, and educators. So I'd like to know, how did you guys get interested in the field of clinical laboratory science?
Well, that is an interesting story indeed. I started my college experience thinking I wanted to become a pharmacist. After 3 years of having a little bit too much fun, I realized pharmacy was probably not where I belonged in the world, because I really loved the laboratory part of all my science classes. And my mother is a MLS and also a professor of hematology at the University of Kansas CLS program. So I spoke with her, and I had that unique opportunity to grow up around CLS with her being my mom, of course. So I came back, I enrolled in the program, and ever since have worked in a microbiology lab and now teach. How about you, Letty?
Well, let me tell you how I got into this field. And I actually was, between my freshman and sophomore year in college, I was taking some summer courses that were not going very well. At the same time, I was working in the biology department in one of the research labs. So I had to go to see an advisor to talk about what my opportunities would be moving forward. And this person turned out to be a faculty member with the lab sciences program at my university in North Carolina, and he's also a microbiologist like you. And while discussing my interests with him, it became very clear that I would be a potentially good candidate for the CLS program there. So throughout my sophomore year, I worked on all my courses, prerequisites, and I also applied for the program, which is a very competitive process, and was accepted. And after that, I graduated in 4 years, and I started a job right after, and I haven't stopped ever since. The lab has really been a great opportunity for me. How about you, Dana? How did you get into the field?
I had a similar experience, with the exception that when I originally enrolled in college, I actually started out as a PR major or public relations major. But once I got into my major coursework, I just didn't really find it to be the best fit for me. And so at that time, I decided to revisit the course catalog. At that time, we had the hard ones that you flip through, not online. But flipping through the course catalog, I came across medical technology. That's what this profession was known as at that time. And so I was reading through the coursework for medical technology and realized that it suited a lot of my areas of interest. Growing up, I knew I always wanted to be in the healthcare field. I just didn't know what I wanted to do in the healthcare field. And so I visited the program, got to meet with the faculty in the department. I applied, went through a very rigorous process in applying because it was a very competitive program. And luckily, I made the cut. And upon completing the program, I was very happy. Something I share with students even now is that I graduated that Friday, started work that Monday, and have been working ever since. And that was nearly 16 years ago.
You need to take a vacation.
I do. I know, right?
Yeah. Well, I did take a week off after school before I started working.
And I took a month off before I started and went to Florida.
See,
Lucky
nice.
you.
Well, as you can see from all of our personal experiences entering into the profession, then and even now, CLS professionals are in high demand. With future career growth predicted to be above average for all professions, CLS specifically provides solid job security going forward. Are you or someone you know interested in a healthcare career? Do you have a solid background in science and math? Do you want to make a difference in the lives of many people? You may consider CLS as a professional path for you. Essential functions for a CLS include good motor skills, and this is referring to your eye-hand coordination and dexterity, effective communication skills, as these will be very important when you're interacting with other members of the healthcare team, visual acuity to perform macroscopic and microscopic analyses, professional skills such as the ability to work independently, manage time efficiently, comprehend, analyze, and synthesize information related to clinical laboratory testing and results.
Learn more about the career paths in clinical laboratory science. We have a couple websites for you to check out. The first is the American Society for Clinical Laboratory Science, or ASCLS.org. Another one's the American Society for Clinical Pathology, also known as ASCP.org. Or finally, the National Accrediting Agency for Clinical Laboratory Science, or NACLS.org. I like to say it like that, it's more fun. Or, it's 2018, you could just Google clinical laboratory science programs, and I'm sure you'll find a couple programs in your area.
Right.
So if you know somebody who might be interested, be sure to share this information with them. So this is all the time we have. Until next time.
In our next episode, we will dive into the different specialty areas of the clinical lab and share some of our experiences working in those different laboratory settings.
We hope you will connect with us. You can find us on Facebook at KUMC CLS Program and through our website, CLS.kumc.edu. For now, this has been the Specimen Not Found podcast.
I'm Dana Bostic.
I'm Drew Jones.
And I'm Letycia Nunez-Argote.